Thank you, ladies and gentlemen. I just want to thank the organizers and particularly the co-chairs for inviting me. I guess I'll learn more here than I'll contribute, but I'll do my best. Over the break, Joe mentioned that, try to be a bit provocative. I'm representing a low middle income country perspective, and I want to show you why it may be a bit confusing. So there are several confusions. The one is when Francis pointed to say, Carel, the other African in the room. I saw lots of people looking and missing the other African. Well, I am a South African, so there is one confusion. I hope can get rid of that. The second is my name. So my last name is Ijsselmuiden. It's a Dutch name. It's confusing. I was in a meeting in Egypt not so long ago, and in the break somebody comes to me and asks if I'm Pakistani, and I said, me. And he pronounced my name as Ijsselmuiden, which, could be there. The third confusion is COHRED as an organization. And it is an international NGO. It has a location in Geneva, now also in Africa and in Belo Horizonte in Brazil. But it is an organization that from its outset took the point of view on global health and health research that would be taken from a low middle income country. So our view is sometimes really opposite and different from what you've heard, I think, in this panel. And I wanted to maybe start then with my provocative conversation. So Gavi is mentioned as an incredible success story, and we saw the reduction of vaccines. And during their 10th anniversary celebration around the Lake of Geneva, they often have posters during the summer season that celebrate some cause. And so Gavi was highlighted as one of the key causes. And in my view, poster number 27 was missing. And poster number 27 that didn't celebrate all the vaccines distributed and lives saved and children immunized, which is clearly a fantastic achievement as a global initiative. Poster number 27 was that until now there's only one WHO pre-qualified laboratory to produce vaccines on the continent of Africa. And that is 10 years after Gavi started getting all its money. And as an African, that hurt. And so that is what COHRED is about, is trying to see if we can get the research capability, the ability, if you want, of the continent up. And I hope to show you that I'm not the only one. So we are after research and innovation systems in low and middle income countries. So yes, my expertise in Africa, but we work globally in all low and middle income countries. We do technical support. We have some practical tools, particularly if we discover bottlenecks. We do some global action. And I'll give some examples of the 3 examples of our work where we're really looking now forward to public-private partnerships. I think we are unique. We're not aware of any particular other organization that focuses on this system of research and innovation in countries as its own source of development. And if I show you, I use 2 examples. Now, the one, because on the panel I knew somebody from Gates Foundation was speaking, although we don't know each other. But if you look at the current global challenges website, you'll see that there are an enormous amount of awards, and the concentration of that is for obvious reason in high-income countries. And there's a huge gap to be built. Well, there are many ways in which you can identify, if you want, the low outputs in research, and it's nothing new. And here's another one out of Nature about 5 days ago, so 6 days ago, where if you look at the life sciences, you don't even see Africa. And a specific note is made on science in Africa, looking at the earth and environmental sciences. And clearly that has to do with the agricultural research that is happening. So there is a tremendous need. So if we talk about a continent that is emerging, that is rising, part of that has to do with creating the science and innovation infrastructure to actually get its health and its other areas under control. So for us, Ebola had a different message. If you've done tropical diseases, you know as I did that 1976 was the first case. We know there are other viruses out there. So why didn't anything happen? And to be very frank and a bit provocative again, I heard somebody say, well, you know, it took 10 Americans to be infected in order to get the vaccine development going. And that is partly an indictment, if you want, of where the global emphasis goes, but partly it is an indictment of Africa itself not investing in its own research infrastructure. But even that is changing. That really fits very nicely with what Francis was saying. So the Minister of the Minister of Science and Technology of South Africa was in New York recently and made that very same case that we wrote also in a blog about 2 months ago, about the need to say that if you really want to sustainably prevent not just 10 diseases, not just Ebola now as a crisis, but you want to get control and on top of the other diseases of which most Africans die and suffer, then it has to start investing in science and technology. So that's part of what it is that we are doing. And it is not just about the good of science and technology, and it is good to fill a gap. There are clear economic consequences, and this particular slide shows you the Seattle area, Washington State, for very obvious reasons linked to the Gates Foundation investment, but there is a substantial spin-off of economic activity that happens around the whole field of global health research, and not just there. But for us, if you want this slide, which was provided to me by the head of the Council of Science and Technology of Tanzania, for us, this would be the holy grail. A serious disease that leads to practical interventions, and consequently that leads to jobs in an industry where Africa somehow shows a solidarity and prefers to buy, if you want, bed nets from African origin. This would be, if you want, the context within which I'm going to show you some examples of how we would operate and where we would want to look for public-private partnerships, and where we have already some. So the first one is to speed up and improve the quality of ethics review of health research, which is a key obstacle, as you'll see. Another example is to create a platform that really highlights, if you want, the role of middle and low-income countries in helping to set the global health research agenda and showcase solutions. And lastly, to look at a way in which we perhaps can create some more regulation or redistribution, or if you want, in terms of the capabilities of doing research around the globe. So this is the problem we are addressing. Ethics review in two major institutions in Africa, two of the key institutions. The one that you see, the note in the passage, were asked to be shifted out of the Ministry of Health because of hazard of fire. There was delays and total unaccountability systems. So everyone who is in product development in health will suffer from that problem. So by creating, if you want, a system that is simple, easy, cloud-based, we could shave 12 months off some of the key ethics review delays that we found in a variety of countries. But in addition to that, there is a real effect, if you want, on reputational risk of donors and funders. I mentioned Pfizer here because I know Jack very well, but we know the Nigerian case, and in fact, to Pfizer's credit, has been investing, if you want, as a partner to RHINO Ethics, to try and see if somehow we can improve the ability and speed up the pace of review. It stands for Research for Health and Innovation Organizer. It is the package of suites we give, and the ethics then deals with ethics review. So with relatively small group of enthusiastic young programmers out of Belo Horizonte in Brazil, we can do all this. So it is pretty flexible package. And thanks to COHRED Africa being established in Gaborone, Botswana now, we've managed to widen out. And the most interesting development currently is that Nigeria has bought, so it is no longer donor funded, but Nigeria has bought 1 national and 6 institutional packages. They're happy with it. We are rounding it off. They're going for another 16. And if that is ready, they'll roll out to the rest of the 35 registered committees. And once that happens, there is a potential for, if you want, for leapfrogging into a substantial ethical review to West Africa and hopefully around the continent. So we are very happy. In fact, we are already thinking about RHINO number 2, version 2, that deals with bringing online information. So if there is a new guideline, I'm sitting on the CIOMS review that is currently taking place. It should come out end of next year. the routine would be that even if a new declaration comes out, a new guideline comes out, it takes really years, if you want, before it gets implemented. With a cloud-based system, we can bring it to you tomorrow, and a month later, we can provide you with a critique or a commentary on, say, how should it change if you want, how you do business. And secondly, we're teaming up with an Oxford University-based group called the Global Health Network to bring ethics review committees in Africa and elsewhere in contact with a community, if you want, of 600-700 other ethicists around the world. So it becomes a question of typing a question as opposed to not knowing what to do. There is an advantage. We have a global reference on this, and it is not just used for Africa. This is where we got the money for, through EDCTP, through Pfizer, through a variety of others. But in fact, the Pan American Health Organization used it to map roughly 1,200 research ethics committees on the Latin American continent, and there are now indications that it will go into to Asia as well. So the question is, a small organization like us, we are not programmers, we are not a sales organization, we are not having the ability to service our telephone commentary list. And so we're really looking for serious private partnerships in terms of finance, programming, scaling, and servicing. We've had 2 prospective partners and declined, partly because the profit motive went beyond what we thought was affordable in the continent. So there is still an issue of finding a private partner plus a funding source who can make up for the difference. But that's where we are in terms of this particular solution. The second example is that COHRED merged, for those of you who don't know the history, it was a global forum for health research. They merged into COHRED in 2010 and 11. And since that, we've revamped the forum to become a platform where middle and low income countries have far more say in what really are the priorities, what are their issues that they want to address, and secondly, how can their innovation environment start dealing with those problems. We put the offer open and immediately got responses from Mexico, Brazil, and the Philippines. So there's a clear wish to host this kind of event, to start taking the next phase. It's not just Africa rising, it's emerging world rising in trying to get influence on this global health research agenda and the potential spin-offs, if you want, in terms of economic activity. So we decided for various reasons to go with the Philippines. And so now the sponsorship, if you want, is basically no more donors, very few. And the Philippine government is basically bankrolling the bases, and then sponsorships. We tried to get not just what, let's say, Francis's list of sponsors were very much North American and European industries, and we tried to make sure that we get a mix between Asian and or emerging market industries. So Serum Institute India is kind of a key person who would be there, for example. In this particular forum, there is one leg that's going to be us. That is the COHRED contribution to it, which was the leg number 1, pillar number 1. So how can we increase relevant, ethical, excellent research and innovation for health in low middle income countries? And issue number 2 is really then left, if you want, to the host organization. And in this case, in Asia and in the region of the Philippines, so next year, they will be hosting the APEC meeting. There will be the next step in harmonization of the ASEAN group of countries. So there is a very driven political agenda, if you want, to have the forum there. So in a way, in this case, we are the private partner to a public agency like the Philippine Ministry of Science and Technology and the Ministry of Health. We take the technical support, internationalization, help with the showcase, and creating this platform in which both the region and the country can then begin to market itself as a more important player, if you want, in this domain. The last example, most of, let's say, global health research grants would happen through research institutions here with funding from here or in Europe. And so the grants ultimately then come down via an institution that has a substantive legal and IP department to, if you want, an African institution, for example, that has none. In fact, when we started counting, it was the University of Cape Town, the University of the Witwatersrand in Johannesburg, KwaZulu-Natal, who had lawyers. That was it. That was the total full stop of IP competence on the continent in terms of your research partners. So surely you can't expect that many of the benefits, if you want, in terms of data sharing, post-trial, post-study results, benefits, IP, that it can be fairly shared if there is a major offices here and none there. So with funding from the Dutch scientific organization, Doris Duke Foundation, we created a program called the Fair Research Contracting. It's moving on to a web-based IP service that uses a Washington-based institution called PIIPA as the ultimate lawyer on the end of the IP line, and they stand for Public Interest Intellectual Property Advisors, a group of about 3,000 lawyers worldwide willing to donate time to courses that they think is fit. So ultimately, there is an NGO resource that could at least support IP. It is a wide partnership. So WIPO is in there, BVGH, a variety of other organizations that focus on trying to create the ability of low middle income countries to negotiate better contracts, which would in turn include the resource, the revenue, the institution building in low middle income countries. And well, to the credit, I think, of our own public-private partnership interaction at that meeting where we presented this, Jack was present and mentioned that actually from an industry, or at least from his industry point of view, there would be a real interest in to go beyond, let's say, a consulting service, beyond the contracting model, and to look at something that could become a COHRED fairness index, for lack of a better word for now, that would focus in particular, if you want, on creating somehow a measurement tool in which research collaborations across the globe start to be rated and ranked against what are the priorities that they are addressing in terms of low middle income countries. What does it do for benefit sharing, in particular in terms of institution building, and how can it build sustainable research and innovation infrastructure? So how can all the global health work that we do contribute, if you want more, have more impact on filling that life sciences cycle component that Africa is lacking at this time, and that other areas are still very low. In fact, to show you how low, is that as part of building up for the Global Forum in Manila, part of the joint sessions will be with the Asian Pacific medical journal editors, and they claim that their journals represent about 54% of the world population, and not one of them is indexed in the Medline library. So there are kind of such in tremendous kind of gaps that still are there. That is where really the focus goes. So in Laura's terminology, it was level 3, if you want, the environment within which research and development works. So yes, this will be a very elaborate partnership arrangement. This is going to be a large group to manage to get around. We're currently at the first draft that should go out 1st January, a consultative meeting. A Wellcome Trust hosted a larger consultative meeting in April of the year, after which we give ourselves, let's say, 6 months to get this thing going. And we would hope that we could connect with many of you in all those different sectors to see if this can be made to work and become a major, if you want, added value to the work that is happening in so many good ways, but that doesn't spend attention particularly on making low middle income countries better able to start dealing with their own Marburg and Lassa and all the other viruses that still hang around and the crisis that will come unless we start dealing with them now. So in this particular case, yeah, we look at a large partnership, formalizing finances, technical support, scaling and implementation. It's going to depend on many people seeing this as a great cause and putting in technology, money, financing, make sure that it can work and can contribute to global development. With that, thank you.
Very good, thank you. Any specific questions for Carel before we open it up to broad questions? Absolutely. Do you have a mic? Thank you.
Sorry.
If ever there were a photograph where you could definitely say a picture's worth 1,000 words, that photograph of the stacks of paper is incredible. My primary responsibility with UPS is working with NGOs. And despite the fact that we've spent billions of dollars on development and billions of dollars on programs, we still have billions of dollars worth of inventory that are on stack cards and paper ledgers and 14 different thousand versions of Excel spreadsheets. And it's beyond my understanding how we're still there. But I think that photograph speaks volumes to it. It's still a serious ongoing problem.
Yeah, absolutely. Oh, Jack.
Comment and a question on the stacks of paper. The interesting thing, though, is that if you do go and speak to the official who's in charge of that and you ask for a particular application, she knows, and it's usually a woman, she knows exactly where in that pile to go and take out the application. That has always impressed me in ethics committees and in regulatory environment. But Carel, one of the things that always strikes me is the parallels between the Fairness Index, which is to really help Africa and low and middle income countries in general punch at their weight and meet their needs. I also see great parallels with the Declaration of Helsinki here when I look at the need for the same global standards to be applied across research. Is that also, do you see that also driving the Fairness Index?
At this time, this technical working group is looking at what could be the indicators, and we are a bit hesitant to make it a Christmas tree on which you hang too many things because it loses lack of clarity. There is a reasonable amount of need, if you want, for still for accreditation of ethics review in low middle income countries. So there are lots of people trained, there are lots of committees. If you look at our map now, we find something like 174, and we know we're missing about half in the central part of Africa at least, so that's the African part. Of those, we would estimate that 50, 60 would have serious ethics competence on board over the many years of training, but many have not yet, and many might be very small committees. So it also would mean that if you have your trials and studies reviewed by one committee like this, you may be under the apprehension that it has been ethically reviewed, yet you end up with a serious problem. Now, in that context, I think certification of ethical review could be justified. Whether we can do it, I'm not sure that this is the case.
I think that I think it is very important to approach that. I heard the number last week that India has somewhere in excess of 800 ethics review committees. So I think you have your work cut out for you in Asia.
Any other questions? Yes, Scott.
Thank you, and let me first thank the panel. I thought it was quite interesting of the scope of activities, and in David's absence, it was great to actually hear academia brought up not only as a research partner, but for the potential of capacity building, which is one of the pieces that I don't think we've dealt with at great length. Also, David certainly spoke about innovation and the potential for private sector being able to push innovation and realizes, I think, as Leslie and at least was alluded to at the Gates Foundation, of also pointing out failures, because innovation will not have the 95% certainty that many of us would like in the research side. So let me just stop for a second and now transition to, I think, what is a question of actually a little bit of a concern, Carl, about the index, what indices are good for and not. And I worked on an innovation for health index with the World Economic Forum for a couple of years, and frankly, we never saw the light of day. Some people didn't believe with the distal indicators that we might say, like, do you have freedom of the press? And how important that is to innovation in health. And the index that you're thinking about here is quite interesting. And the question I have is, how is this agenda being set of what are the important areas? So while Leslie highlighted the NTD piece, I mean, I great to see the piece there. I know there are about 8 different political levers that got that London Declaration into place, and the companies that got together there. There are other levers that are in place clearly, and I'm wondering in the global health area, and why I think it's interesting for this group, how do we figure who is setting the agenda on these areas? So does your fairness index deal with the global burden of disease data? Do you look at, somebody mentioned infectious disease, Marburg, some of these other pieces? Do you go to morbidity areas? And the whole agenda setting function that seems to be lost without global health leadership, which a lot of people are suggesting now, the global health leadership is going from issue to issue, raises an important question. So I don't know if this is right for this panel, at this juncture, but clearly there's different areas. P&G, I saw 10 years ago in Geneva when you were starting that water piece, and it's great to see it scale. Certainly PEPFAR came when there was an emergency response, and still some people forget, what happened in those early phases. And, the foundations have helped set the agenda in areas that often didn't have a lot of research. So, Carl, I guess you did the wrap-up. So does the index take a specific area that's important to people in those countries, or is this more global epi data than trickling down and trying to come up with a research and innovation agenda?
As it is currently work in progress, I can't give a comprehensive answer, but the purpose of the index is to add a component, if you want, to the global health research and innovation agenda that brings home the fact that much of the world for which global health happens is not a partner in the development of it, nor in the economic benefits. And that is what we want to address with the index. And so for practitioners, if you want, in the global health arena, what it would create let me take one step back. So you might be aware that in the Swiss Tropical Institute group, there is a set of 11 principles of good partnerships of research collaboration. It's called the group KFPE, and it's a book out. And well, if you do that, then you have a good partnership. And it is entirely really directed, if you want, at the goodwill of the Northern institution. This is how you do good partnerships. What the index would allow to happen is to locate the power, like the fair research contracting, also on the other side, and say, look, if we can convince, for example, an institution or a country who are interested in this, so African countries, Latin American countries, they're interested in the concept of a fairness index, and say, well, if we would tally off and people would come and work in this country, provided they do A, B, and C, and D, we don't have to renegotiate every time. What would happen? New donors, you bring 10 donors in a room, they have 10 different requirements, that could be simplified. So we could speed it up and potentially put more resources, if you want, into the local research and innovation infrastructure. What it would measure, it is literally at this time between now and end of April, there is a lot of thinking going on with a lot of people on exactly how to construe it, but I would love to speak to you about also finding indices that didn't see life.